Okay. So you can, one question you can do it. Okay. You can read and you just think you are doing a case study analysis. Okay. Yeah.
A nurse in the emergency department is caring
Mm,
for a
mm,
6 years old client
mm,
known to have sickle cell anemia. Nurses notes and development. A child with a history of sickle cell disease is
mm,
brought by caregiver with pain in the upper and
mm,
lower limbs. On assessment, the
mm,
child is alert but irritable and lethargic.
mm,
Yellows clear of both eyes,
mm,
noted as difficulty in breathing.
mm,
Vesicular breath sounds escalated.
mm,
Overall, the lung zone, dry mucous membrane,
mm.
capillary refill 5 seconds,
Yeah.
and S1, S2 her
Mm,
with the emic murmur, hands and knee joints painful
mm,
and warm to touch and swollen bilateral.
mm,
No abdominal tenderness, no
mm,
hepatose splenomegaly,
mm,
bowel sounds normative, cold.
mm. Okay. So,
Vital signs,
mm. Vital signs, atomic temperature.
temperature 100.6,
Mm.
heart rate 135,
Yeah.
respiratory rate 38 per
Mm.
minute,
Mm.
blood pressure
Mm.
92 over 60,
Yeah. Saturation.
saturation 89,
And next is history.
medication
Medication history. Yeah. What is the medication history?
is taken ibuprofen 200 mg,
Mm.
folic acid
Mm.
1 mg per hour per only daily.
Dead. Okay. What is the question?
The nurse in the emergency department is caring for a 6 years old client known to have sickle cell disease. The question is click to highlight the findings that require immediate follow-up.
Mm.
Immediate follow-up. Diabetes steps. Brought pain in the upper and lower limbs. Can you just mark the pain in the upper and lower limb?
Okay.
On assessment,
Mm.
patient is alert but irritable,
Mm.
lethargic, yellow clear of both eyes
Mm.
or as difficult in breathing. Some can just mark difficult in breathing.
Mm.
Vesicular breath sounds as indicated. Overall, the lung sounds
Mm.
5 meters. Capillary breathing 5 seconds. Yes, one is to her with a moving murmur. Hands and knees feeling painful and warm
So
to
one
touch.
thing I want to tell you, yesterday we have discussed the question at that time. We have said that we have to focus on the abnormal findings
Unexpected.
first. Okay. Then we have to look for the unexpected one. Abnormal findings we can choose it, but in that we can look for we can eliminate the expected abnormal finding, but we can concentrate for the unexpected or critical situations which are going into worsening stage. Okay, so this point you have to keep in your mind and then you can highlight it. So you will get the answer. I'm just give one support. That's it. Okay.
Oh,
So what is the diagnosis here? What is the diagnosis?
sickle crisis,
Sickle cell
sickle
disease.
cell.
Okay, so cell disease, we should know about the theory. What is here? The RBC will become the shape of what? Sickle cell. Okay, so what happened when the sickling of the RBC is happening? It will occlude the blood flow. So there is a pooling of the blood flow can occur. Okay, that means it will interrupt the blood flow. So it will affect the perfusion problem. So that only because of the hypoxia the client is having all the hypoxia symptom. Okay. On the assessment, it is written what? The client is irritable. Okay, irritable. The client is having yellow sclera on both eyes because the hemolysis is there. And also difficulty in breathing there and dry mucous membrane, capillary refill 5 seconds. Is it a normal? You have to think it. Okay, I'm not telling anything. And the S1, S2, is it a normal or abnormal? Hemic murmur is hearing, and hand and knee joints painful and warm to touch. And you have to think what are the normal, what are the abnormal, and we can click the abnormal findings. In that, we can what? See, the question it is asking about immediate, which findings that require immediate follow-up means some abnormal findings are showing the worsening of the patient condition. So that is your answer. Okay, got an idea? Okay, then you can
Yeah.
highlight. Yeah.
And it's most of the symptoms are associated with the disease condition only, like pain,
Mm,
yellowing of skin.
mm.
Then I'll go with the saturation lower segment. Just mark the saturation in vital signs.
Which one?
Saturation 89 is there.
Saturation 89 is there. Yeah. Then
Respiratory rate also.
respiratory rate.
Hemic murmur is some cases will have in anemia cases. Right? The pain is expected in sickle cell crisis.
Look.
Difficulty
Mm. And
Capillary refill is abnormal now.
is, yeah, dose again is normal.
yeah.
We both
So
capillary
it
refill
should be always less than 3, not 2 seconds, 3 seconds.
dose.
But here it is showing 5 seconds. That means delayed perfusion, delayed capillary refill. Okay, that means there is an inadequate perfusion is there. Next.
That vesicular breath sound,
Hmm. Vesicular breath sounds
auscultator,
over.
all the lung sound.
That is normal, no? Vesicular breath sounds are over.
That's normal.
Normally
Vascular red
auscultated
sounds.
over the lung field only. Bronchial,
Okay.
bronchovesicular, vesicular. Vesicular, bronchial over the trachea, the bronchovesicular over the bronchus, and vesicular over the lung field.
Now let's take it up the pain and upper lower limbs.
Pain in,
Because in
okay,
sickle cell crisis,
yeah.
no, sickle cell crisis patients have pain, but
Mm.
we have to give attention to the pain in the sickle cell crisis actually. So very confused, ma'am. I lock the answer. Pain,
Vowel sound,
Vowel
bowel sound
sound,
is normal,
it is
or no?
normoactive.
normoactive. Bubble sound is normoactive means active only, normal in all the four quadrant. And if it is slow, that is hyperactive. If it is high, for example, in a diarrhea, the bowel motility is higher. In such cases, we will get a hyperactive bowel sound. And in case of constipation, there is bowel motility is less. So in such cases, there may be diminished or hypoactive bowel sound. But here it is written bowel sounds normoactive. Is it need an immediate follow-up?
No, no, no,
No,
no.
No. Yeah. And always you can check it. First, it is you have logged about pain in the upper and lower limb. You can check with the question, is it need an immediate follow-up? Then you have logged then irritable, lethargic, yellow sclera on the both eyes. You have to check it whether it is need an immediate follow-up. And difficulty breathing is need. And whenever we are getting a difficulty breathing, always you have to check the oxygen saturation. See the saturation 89% on the room air. So you can think it whether it is needed and immediate follow-up. Next,
ma'am, I lock
basic,
the answer.
you are
Just
locking the
mark
answer.
the, no, pain and upper lower limbs also.
Pain in the
Uh,
upper and lower limbs also.
then
And
heart rate.
which one?
Heart rate, it's quite
Heart.
IS exactly.
That no need to highlight it. Actually, we cannot.
That's all, ma'am.
Yeah. What
That's
about,
all.
yeah, Veena Cheshi, do you have any other option? I will just show you the options here. The options,
I'm little bit confused with the pain in the upper and lower limb.
pain in the upper and lower limb, you have the confusion. And what about the vesicular breath sounds? It
It's
is
normal, no?
auscultated over all the lung sounds. And next one, this abdominal tenderness is there. Do you want to lock
No,
it?
no.
No need. Okay, actually, when we click it, no, at that time it will show which one we need to choose it. In that, we can eliminate the options. Okay, and all the points will not get highlighted. See, bowel sounds is normoactive. The temperature we cannot highlight. Heart rate cannot. BP is it? BP is needed. 92 by
No.
60. Is it needed?
Actually, that is a hypo, no?
No, I'm asking
6
to
years
you.
old.
6 years.
Yeah, 6 years old. The BP is 92 by 60.
No
So,
need.
no need. So, okay, I'm going with this answer and we can check it. So, now you got an idea about the scenario, about the vital signs, and what are the findings, assessment findings. Okay. So, you just check it once again. Can I submit the answer?
Amit, ma'am.
Yeah, we can
Please.
submit the answer and check it. Okay. Yeah. What are the answers you have logged? Pain in the upper and lower limb, difficulty breathing, capillary refill, respiratory rate, oxygen saturation 89%. How much marks you scored? See the difference.
Fine.
Okay. So your analysis was, it was good or it was confusing? Got a
Slightly
clarity.
confusing.
Which one?
No. The beginning was slightly confusing because there's a most of the symptoms is associated with the sickle cell
Yeah.
crisis.
Yeah,
So
yes, that is the point here. If the client is complaining with the severe pain, okay, mostly there is a pain will be there, but the client see the difference here. The child with a history of sickle cell disease brought by the caregivers with the pain in the upper and lower limbs. That means previously there were no pain. Suddenly the client has developed. That means when there is a new onset of symptom, it should be managed immediately. Okay. And also, child is alert but irritable. Irritable means what he is having severe pain. Okay. And also, there is hypoxia is there. The so child is irritable and lethargic. Yellow sclera of the both eyes can be an expected one. Difficulty, yeah, breathing, vesicular sounds, and dry mucous membrane, capillary refill is an abnormal because capillary refill 5 seconds indicating that there is a delayed perfusion. Okay, we can check
okay.
with it. Yeah, and uh, next you have chosen the saturation. Is it saturation? It is 89 only. That is very low. The client need oxygen support, and also the client is tachypnic, 38 breaths per minute. And BP 92 by 60 is in a lower side only, but it is almost in a what? It's, can be an expected BP for a 6-year-old child. So, what can be the answers? What the client is having pain, breathing difficulty, delayed capillary refill, tachypnea, and hypoxia. Okay, so it is good, Ambarasu. Your analysis was good. So next is Veena Chechi's turn. So can you already we know the nurse's notes, vital signs, okay, medication history, we know. So what is the question? Can you please read it and choose the answer?
Yeah, complete the following sentence by choosing from the list of options.
Mm.
The client's mostly likely diagnosis is dash,
Mm.
evidence by dash.
Yeah.
So, vaso-occlusive
Vaso-occlusive crisis.
disease
Mm,
evidenced by,
mm.
can I show you that one? See.
Pallor, sclera, lower limb, upper and lower limb pain.
I think it's
You must
upper and lower limb pain.
upper and lower limb pain. So that means all the symptoms are because the client is having what? Sudden onset of symptom, hypoxia. That means something is interrupting the blood flow because of the occlusion, blood vessel. This sickled RBC is blocking the blood flow. So there may be a vaso-occlusive crisis is there, and it is evidenced by upper and lower limb pain. That is your analysis. And Anbu, are you agreeing with Veena Chechi or do you have any other option?
I'm agree with that.
Same only. Okay. So we can submit it. Yes, that is the correct answer because we know that sickle cell anemia or sickle disease is a inherited blood disease, and here when the sickled RBC is blocking the blood vessel, so it can lead to what? It can lead to vaso-occlusive crisis. So when there is a vaso-occlusive crisis, it will affect the blood flow through the blood vessel. Okay, and it can affect the perfusion. So when there is an inadequate perfusion, it can lead to what? Hypoxia. So the pain in the upper and lower limbs are indicating what? Hypoxia only because the sickled RBC is obstructing the blood flow through the blood vessel. Okay, and that is the correct analysis. Okay, it's good. So I think you got a clarity. Yeah. So next turn, Anbu's turn. Is there anyone or only you two? I have only you two. Okay. So you can read it. It's a SATA type question. You should be very careful while choosing the answer. Okay. You can read it
Yes.
and tell me the options. I can lock it.
What orders by the healthcare provider does a
Hmm.
nurse anticipate?
Hmm.
Administer O2 as prescribed.
So then you have to check it. How much is the saturation? How much is the saturation
That's
here?
it's 18.
89%.
So
Is it need an oxygen support?
we lock it.
Yes.
Yes. Okay. Next, restrict the fluid
Restrict
intake to
fluid
1
intake.
point. Yeah.
We should administer.
Is it need for a fluid restriction here?
No.
There's nothing mentioned about any
Mm.
overhydration something. So and also the patient is has very
And also here, no need to restrict the fluid because already there is a vaso-occlusive crisis
as
is
that
there.
if we are restricting fluid, then again it's make work.
Yeah.
So I don't think so.
Again, that means blood is getting concentrated because of the sickled RBC. So we are not restricting to 1 point. That is it related to anticipate or not?
No, no,
No.
no.
So next option, administer oral hydroxyurea.
Hydroxyurea.
Mm.
Just a second. I
Hydroxyurea.
don't think so. Um,
Mm.
it's yes, ma'am, we can use it because administer oral hydroxyurea can be cured for vaso-occlusive pain actually. That is it.
Yeah, it is a that it will increases the HB level, HBF. Okay, that means mainly in case of sickled RBC, this uh, hydroxyurea can be used for reducing the vaso-occlusive episodes. Okay, that is it is an anti-metabolite and it's a myelosuppressive medication. And one more thing. That means already the client is having severe pain. Okay, so it will reduce the risk of this vaso-occlusive crisis, hydroxyurea. So is it needed?
Yes, ma'am.
Oral hydroxyurea. I don't know about it. Checking it. Okay, next you can take it. Okay, for the patient,
Administer.
I will tell you about the general thing about this. hydroxyurea because it is no, it is a theory, no? I will tell about it. Actually, is there any notes here? No. Not able to text. Okay. Okay, I will read it and tell you. Okay. It is not going to copy. Actually, for those who are taking this hydroxyurea, we should check the order. Okay, take the exactly the order as prescribed and swallow the capsule whole. We should not crush or open the medicine. Okay, and we can instruct the client to drink a lot of water, plenty of water, unless restricted, and wash hands after handling the capsule because it is an anti-cam. That means it is anti-metabolite. It is coming under the chemotherapeutic agent also. So we should, while take after handling the medicine, we should wash our hands, avoid contact with the people who have infections. Okay, and if anyone who's taking any contraception and treatment in such, we that means here this hydroxyurea can be given in a what effective way. Okay, and also keep all scheduled lab appointment ready, and if the client develop any fever, any unusual bruising, bleeding, or persistent fatigue, it should be reported immediately. Okay, that means it is a oral tablet, so that only I want to make it. So is it locking the answer? So next one, administer antibiotic as prescribed. Is it needed?
Antibiotics, I don't think so. Because it's not showing it. Can you go to vital signs? There's no sign of any infections. They didn't mention anything about infection.
Okay, so you are eliminating option
Right.
D. Next option, administer morphine as prescribed.
Um, this one I'm quite confusing because adult we can give morphine,
Mm.
but patient is only 6 years old.
What is the action of morphine? It is used as a opioid analgesic. Okay. So it is written prescribed morphine. That means if the physician has prescribed a morphine according to the what uh, dosage of the 6 year child, it can be given. But here,
We can
yeah, is it needed?
when we take on this.
Okay. The next one,
Then
transfer.
transfers PRBs. Yes, ma'am, we can do.
We can do. Okay. So, Beena Chechi, are you agreeing with Anbu or you have any other option?
No. I'm agreeing with this one.
Agreeing with
No
this.
need to restrict the fluid. We have to administer the
No,
fluid.
no, that was by mistake only. That was my,
Okay.
yeah, I'm not selected. So all these
Okay.
are the options, and we can check it. And again, you can think it about the options which you have chosen: oxygen, hydroxyurea, then morphine, and the PRBC. Okay, transfused packed RBC is it? We can check it. The answer. So what is the answer here? This option C got wrong. Why? Because it is necessary because the client oxygen saturation is 89, sorry, hydroxyurea. While hydroxyurea is an important long-term management medication for sickle cell disease, it is not used for an immediate crisis management. Okay, so that is the analysis. Then it works by increasing fetal hemoglobin production and reducing the frequency of crisis over time, but it is not effective for acute symptom. Okay, got a new information that the hydroxyurea is a treatment for the sickle cell anemia, but it is not used for a which one immediate basis. So here the client is going into a stage of what? Sickle cell crisis. That means it is a acute stage. So in such cases, hydroxyurea is not administered. So other answers are correct only. But here the antibiotic
Antibiotic.
we have not chosen. We can check it. Antibiotic. So here, yes, why? Because see, the client has the temperature 38.1 degree, that's 100.6 degree. Okay. And when the client is having a history of sickle cell disease, there is a higher risk for infection because it's a immunocompromised. Okay. So when the client is having sickle cell crisis, so to prevent the further occurrence of the infection, better to start with the antibiotic. So these two points you note down somewhere because it's a confusing one. Even we don't know about that, the hydroxyurea, as well as in sickle cell disease, we are using the antibiotic. Okay, got it? Like, so that I'm saying, whenever we are practicing question, we can read the rationale of the right answers as well as the wrong answers. Okay. And also we can check the answer for the this fluid restriction also. Here we need to promote the adequate hydration, not fluid restriction. Why? Because when there is a sickle cell crisis, there is a pooling of the blood, and it can cause increasing of the blood concentration or viscosity can get increasing. That means there is a resistance to flow the blood through the blood vessel. So here we need to administer adequate hydration, not restriction. Okay, so that is the correct analysis. Next one, administer oxygen. We know the saturation was only 89%. And so why we are administering morphine? That also we can check it because the client is having severe pain. We know that when there is a significant pain, it need to get managed. Okay. And why we are administering the PRBC? That in sickle cell crisis, there may be severe anemia. Okay, so to manage with the anemia, to increase the hemoglobin level, we can administer what this packed RBC. Okay, got the analysis. It was a good question, I think. Okay, so any doubt on this? Whether I need to clarify any options? Why the option became wrong or why the option became right, like that? Any confusion? Okay, Veena Chechi, do you have any doubt on this and any options? Do you have? Okay, we can go with the.
No.
Okay. See how much mark you got it. You have to check it. How much mark you got it? And to check it. It was your answers.
Out of 4.
Out of 4, we got 2. But
Yes, ma'am.
already you have chosen 3 correct answers. Okay. But what happened? From the 3 marks, you have,
Negative mark.
yeah, negative. The 1 you were not selected, and the 1 was wrong only. So for the wrong answer, we deducted 1 score. Okay. See here, the option was not chosen. Okay. So that mark we didn't loss or gain, nothing has happened. But we deducted the wrong 1 mark for the wrong answer. So that only we got how much? 2 marks. That means 3 correct answers you given. So 3 marks you got. But from the 3 marks, you made a mistake. So 1 mark deducted from your gain mark. So you got 2 marks. Okay. So that is the scoring. So SATA model, we should be very careful. So audible. Okay, it's a wonderful question. Veena Chechi, you can analyze. See, some healthcare prescriptions are there. 1 second, I will connect the lab with the charger. 1 second. Yeah, you can. Anbu also, both of you can, because it's a complicated question, both of you can analyze it. One will read. Veena Chechi can read and we can
Yeah.
analyze. Yeah.
For each of the following findings, click to specify the corresponding disease process. Each
Mm.
findings may support more than one disease process, and
Mm.
each category must have at least one response selected.
Okay.
Okay, for dyspnea,
Mm.
we can see it in the vaso-occlusive crisis.
Mm. Okay.
acute chest syndrome.
Mm.
I'm a little bit confused with this aplastic crisis.
And the splenic sequestration. Okay.
Yeah. Upper and lower pain will be, I mean, the vaso-occlusive crisis will be there.
Mm.
Acute chest syndrome, splenic. At least we have to select one response, right?
Yeah.
Get. Okay, for this upper and lower limb, I can choose vaso-occlusive,
Mm.
uh, acute chest syndrome,
Mm.
aplastic crisis.
After this, I will tell you each condition. Okay, I will check it. Okay, then
Yellow
alloscleral
sclera also, that's splenic sequestration.
sequestration. Mm.
Sequestration. Vaso-occlusive crisis also,
Mm.
and upper and left upper quadrant tenderness, left upper. That is comes under acute chest syndrome.
Mm.
This is side of the spleen. Spleen comes. Yeah, the splenic sequestration.
Mm.
Temperature 38.
Temperature 38.1 degree.
Slightly higher actually. Aplastic. Vaso-occlusive crisis.
Okay.
Abdominal pain.
Abdominal pain.
Pain and vaso-occlusive.
Mm.
Splenic.
Mm.
Uh, yeah, I'm going with this. I'm a little bit confused about this.
No problem. It is a tough question. No problem. And I will tell you each condition. Okay, vaso-occlusive crisis already we know. What is it? When the sickle derby is occluding the blood flow through the blood vessel, the blood will become what? Viscous, and it will prevent the blood flow through the blood vessel. That is the vaso-occlusive crisis. Okay, so mainly what happened here? Here the client will experience inadequate perfusion, so client will experience severe pain, joint pain, pain in the arms and legs, back pain, and abdominal pain. In some cases, the client experience mild fever also, and the swelling because of the hemolysis. The client will have the yellow sclera. Okay, these are the main symptoms related with the vaso-occlusive crisis. Okay. And acute chest syndrome means when this sickled RBC is blocking the vessels in the lungs. In that condition is the acute chest syndrome. Mainly in case of infection like pneumonia, then fat embolism or pulmonary vaso-occlusion. We know that when there is any thrombi or clot which formed in anywhere, it can travel and it can come into and block the pulmonary vessel. Okay, so here in this sickled RBC, already it is blocking the blood vessel. When this sickled RBC is blocking the pulmonary vessel, it can cause what? Acute chest syndrome. Okay, so the main signs and symptoms are fever will be there, chest pain will be there, dyspnea will be there, cough will be there, and client will show, already there is a pulmonary vessels are occluding, so the client will show the hypoxia symptoms. Okay, and the tachypnea, crackles will be there. And the next is which one? Splenic sequestration. Here, the splenic sequestration means when the large amount of blood suddenly become trapped inside the spleen. Okay, it can cause the enlargement of the spleen. Okay, so it can lead to sudden drop in the circulatory blood volume. That means the spleen will get enlarged. Okay, and the blood volume in the spleen will increases due to the splenomegaly, but the circulatory blood volume will get decreased. Okay, and it's most commonly in case of children, and the main signs and symptoms including are left upper quadrant pain, but because the spleen is located in the left upper quadrant of the abdomen, so client experience left upper quadrant pain, enlarged spleen, and the sudden weakness, pallor, tachycardia, and hypertension will be there. Hypertension, why? Because of the circulatory blood volume is low, because the blood volume in the spleen is getting increasing, and it can lead to hepatomegaly. Okay, and next one is aplastic crisis. Aplastic crisis means here we know that the RBC is producing from the bone marrow. When the RBC is not produced from the bone marrow, that is aplastic. That means no production of the RBC from the bone marrow. Usually in case of what that means parvovirus B19 infection, in such cases, and also aplastic anemia. And when the anemia is getting worsened, it can lead to a aplastic crisis. The main signs and symptoms are severe fatigue, pallor, weakness, dizziness, tachycardia, and severe anemia will be there. Okay, these are the main findings which are related to each condition. And when the important one is in aplastic crisis, there is a sudden decrease of the reticulocyte count, because the client will not have the pain, but there is a decreased count of the reticulocyte. Okay, so there is, and one NCLEX tip I can tell you that in vaso-occlusive crisis, the client experience pain everywhere. Okay, but in acute chest syndrome, the client has problem with the lungs, because the pulmonary blood vessels are occluded with this sickled RBC. In splenic sequestration, the blood flow is tucked in the spleen. That means the circulatory blood volume will be low. So the symptoms are relating with the low perfusion. Okay. And in aplastic crisis, there is no production of the RBC from the bone marrow. This is the condition related with each one. And Anbu, can you please recheck the answer, or do you want to make any changes? You take this question as a study mode. Okay, don't worry. Take it as a study mode. Dyspnea is a vaso-occlusive
You can
crisis.
add to the acute chest syndrome.
Yes,
Acute chest
acute
syndrome. Yeah. And
also aplastic crisis
aplastic crisis,
because decline production of
there is decreased production of the RBC. It can lead to hypoxia. Can be
dyspnea of
occur.
course.
Maybe can be occur. What about splenic sequestration?
No, I don't think so.
Okay. Then upper and lower limb pain.